Hey everyone, welcome to the 211th episode of the Internet of Things podcast. This is your host, Stacey Higginbotham, and your co-host,
Kevin Toffel.
And we have a jam-packed show for you today. We're going to kick it off by talking about Stringify shutting down, offer some alternatives, and talk about it being the end of the Wild West era in the smart home. We've got Google announcing their Anthos cloud platform. It's very important for the edge. We'll explain why. Sonos and IKEA have launched a group of products that we have questions about. This week at a big security conference, cameras with inference at the edge are a big deal. We'll talk about what that means for suppliers and for us as regular humans. Kevin also has an update on the mysterious Google Mistral device that we will talk about. And there is a new HomeKit-enabled energy strip available for all of you who are still dedicated HomeKit fans. And JD Powers is getting in on the IoT. We're also going to hear from our sponsor, Software AG, on how to implement better data collection for AI. And our guest this week is Andy Corvus, who is the CEO of Electra Labs. She's going to be talking about what it means to bring IoT into clinical trials, and about her time at the FDA and what that agency is doing to help drive innovation in digital health with today's consumer devices. So, all of this and more awaits you after a message from our sponsor. This week's sponsor is IoT World. Are you going? IoT World is the intersection of industries and IoT innovation. It is May 13th through 16th at the Santa Clara Convention Center in Silicon Valley. IoT World will welcome over 12,500 IoT professionals, 400 speakers, and 300 exhibitors and startups. You can meet thousands of IoT leaders from Boeing, CVS Health, ExxonMobil, Ford, Google, Procter & Gamble, Starbucks, UPS, and more. And we have an exclusive listener discount of 25% off your pass with the code STACEY25. That's Stacey, STACEY 25. And you have to visit IoTWorldEvent.com to register. So, if you're listening to this show, you're interested in IoT, so go check that out. And don't forget the code STACEY25. All right, Kevin, let's kick it off.
What a sad start to this week.
I know. And man, so Stringify, we got an email, all of the people who use Stringify, which is a software-based program that allowed you to basically create, they called them flows, these really complicated recipes for IoT devices. I used it a lot to create things like I had the ability to tell Google or my Amazon Echo yoga time. And what would happen is my shades would come down, my lights would dim, my television would turn on. So, because I do yoga with the video. So all of this happened and my air conditioning would actually go down because hot yoga is for fools. So all of that would happen just with the words yoga time. And it was awesome. And now I can no longer have yoga time.
Well, you could have yoga time, but you won't have yoga time with Stringify. And when Comcast purchased Stringify,
and this was about 18 months ago.
Yes, we said, I'm pretty sure it was both of us that said, when do they shut it down?
And it makes sense. Comcast wanted Stringify because I have complicated feelings about Comcast, but when it comes to the smart home, they are doing a bang-up job of creating a really good interface for people to use. And Stringify helped them get that kind of capability.
This is with their X1 platform, right?
Yes, their Xfinity Home, X1, they all have the same names. And Comcast is actually doing a three-fronted job. They're improving Wi-Fi, and they're doing a good job with that with Plume. They're improving security. They've created a bunch of new security services for connected devices, and they're improving their voice interface with the X1 platform.
Yeah.
So they've got all of that, and Stringify made sense.
Yeah, it did. And I know we have people that listen to this podcast who are very passionate about Stringify and love it. And I get it. It's great. I lean towards if this then that personally, but it's the same concept. And it provides a valuable service for you to connect things that are not otherwise natively connectable, right? But to be fair, I don't think a massive amount of people are going to be affected by this. Yes, again, people who are listening to the show, probably a fair amount of them. But we looked at, the download numbers for the Stringify app compared to the If This Then app. And what did we find?
We found very sad differences. So the Stringify app, by the way, you guys, the Stringify app is no longer in the App Store. So we looked at the cached version for March 30th, and we saw that it had over 100,000 downloads, which actually surprised me. But yay. But IFT has over 5 million downloads. And this is in the Google Play Store. I'm sorry, not the App Store.
Correct.
But a lot of people using this, more people than I anticipated, but not quite as many as, a superstar breakout product. So it makes sense that Comcast would be like, yeah, we don't need to support this anymore. And if you have your Stringify flows, those are going to be available to you until June, and then they're going to die. So I guess I have yoga time till June.
Which kind of leads into two related topics or questions. What do you do? Where do you go instead of Stringify? We could tackle that first. But then the second question is, how do you get your stuff out of Stringify? And the easy answer is, you really don't. I mean, I hate to say it. And there needs to be, and you and I, Stacey, we've been talking about this for the past couple of days. All of these routine type platforms are built on standards to a point because they're using the available APIs for all of these devices and hubs and such and they put a nice interface in front of them and make them work together. So those are out there and available for anybody. But the interface part, there's no import, there's no export. So it's not like you can get those routines out and move, say, from Stringify to an If This Then That, for example.
So yes, you have to say to yourself, I am prepared to spend another few hours taking all the things I did on Stringify and moving it over to another platform. It is unfortunate. I would love for the industry to come up with, because these are all API calls, or most of these are API calls, it does make it challenging. But I would love for them to come up with like a file format where you can pull these API calls and be like, hey, I want the same thing to happen in this new platform. Some people might just shrug and be like, that's what you get for being an early adopter. But I think it also will help with things like vendor lock-in. So I've had people ask me, they're like, God, are you worried that, if you adopt Google, then you can't adopt Amazon later? And I'm like, actually, I have both, but I see your point. So
for options, if you're a Stringify user, we mentioned If This Then That. Would you say Node-RED is another potential option?
Yeah, actually, Node-RED would be interesting. Now, with Node-RED, you have to run Node-RED on another platform. So you still...
Like put it on a Raspberry Pi or something.
Yes. I was like, you can't just be like, go to the web on Node-RED you can't just have your phone. There's no Node-RED app for your phone. That's going to be a little bit of an issue. And there are a lot of things like that out there. So you could run that on a Raspberry Pi, and that has a very similar flow-based. It's GUI. You run things around, and you're like, ooh, if this, not if this, then that. Oh, no, bad.
A Raspberry Pi is your typical device that you would run Node-RED on, because a Pi, and the most you're going to spend on your Raspberry Pi is like $35. You could run it locally. You could actually create a Docker container. If you have a Linux machine, you could do it there. You can do it with an Arduino or a BeagleBone Black, or if you use, and I know a lot of people won't be familiar with this, but I've used it before, the Termux app in Android, which is basically a terminal emulator. You could run it there, or if you're like me and gravitating towards the cloud, you can put on IBM Cloud, Sense Technic Fred. Never heard of that. Amazon Web Services or Microsoft Azure. What's Fred? I got to check Fred out after the show. But so you have a lot of options, but no, like you said, Stacey, app to download to your phone and just get going.
Yes. So, and in that same vein, there are a lot of other platforms that you could use that are not Node-RED. So you can use OpenHab. You could use Home Assistant. You could use Homebridge. And all of those are open source based programs that let you download their controls basically to a Raspberry Pi. You link all of that up. And like Stringify, these are actually incredibly rich and can let you create all sorts of crazy things. But they're actually more difficult to use than Stringify. I find myself,
right.
in some ways, I'm paralyzed by choice. I'm like, oh my God, there's so many features. Like you can see sensors in your devices that, even the manufacturer may not have exposed. So
yeah, it gets down to how technical you want to get. Like if you want to get into building things with HTML and JavaScript and you're comfortable with that, yeah, Node-RED can do that for you or can offer that to you. But you're going to be tinkering a lot, same with the others that you mentioned, you're going to be tinkering. This is none of these are like a quote unquote off the shelf solution.
But closer to off the shelf and purely software based in the same way that Stringify was would be something like Yonomi, Yonomi. They have a software platform. It doesn't have as much granularity, but it is really easy to use. And the cool thing about Yonomi is you can actually run the app. It'll discover a lot of the devices at your house, and it will actually automatically start suggesting recipes or flows or apps, applets, whatever you want to call them, for you using the particular devices you have, which I think is really user-friendly.
I like that a lot. That starts getting putting the smart in the smart home. And it's something that Madam A has been doing with the hunches.
Yes, although I haven't seen hunches yet. Have you seen hunches?
No, and I'm home all the time. Like, they don't let me out, so I'm shocked, I have a very repeatable process between coffee, writing, nap time, Netflix, and so on. So I don't get it.
Yeah, and I haven't gotten Guard either. I signed up for the beta program for both of those things, and none of them have happened for me yet.
Guard, that's where the Echo will listen for broken glass as a security feature.
Yes. Okay.
Yep.
That was a little segue. Side note, that wasn't a segue. That was just that was just us being distracted. Okay.
A day in the life of Stacy and Kevin.
Back to, so other than Yonomi, there's everybody's favorite, IFT, which we actually talked about fairly recently. There's some turmoil at IFT, leadership changes, that sort of thing. So
I still say they get bought.
Yeah, I know.
I say they get bought by a Google or an Amazon.
We'll see. So IFT is still a good option. It is not, you can't do the multi-pronged applets. You have to do everything individually, so it's not as powerful. And then if you're a SmartThings user, you could actually build your own apps for some of this stuff.
Groovy.
And on Google, oh, you're Groovies because they use Groovy.
Yes, the Groovy language. Yeah.
And if you're an Amazon Echo or a Google Home user, you could actually build some routines and use those for voice control. The cool thing about the Stringify thing was they didn't actually have to be based on voice. They could be, mine were based on voice, but they could have been based on like a sensor trigger. Which
any trigger event, right?
You can't get. If you're HomeKit though, you can use sensors as a trigger for certain, I don't know if they call them routines, certain things.
I believe they call them automations in the Home app.
Okay. Automations. So many words. Yeah. Okay. So those are your alternatives. And I wrote a post about this on the site. I said that Stringify, and there was a post earlier this week about people being like, we can't recommend the Wing Cub anymore, which Kevin and I are also kind of like a little cautious about the Wing Cub. I said this was the end of the Wild West era in the smart home. And just to put that in perspective, I really thought back in 2012 when we started this that you were going to be able to pull like sensors and outlets and connected devices and like create your own stuff with them, kind of like Yahoo Pipes, if you remember that.
Yes.
But just to build your own experiences in a way that was pretty easy and pretty reliable. That never happened.
Yeah, I mean, because things are getting siloed, unfortunately, to the different platforms. There is still the open source options that you mentioned, and mainstream people are not going to likely go get a Raspberry Pi and install OpenHAB or something like that. But your vision that you had in 2012 is available to people if they want to put the time and effort into it.
Yeah, I just thought it'd be more easily available to everyone. My bad.
It's available to everyone, but not everybody wants to invest the time and technical knowledge and learning to do it.
Yeah, I was hoping it'd be easier. I was hoping it'd be kind of like creating a Wix or a Squarespace page for like HTML, right?
Mm-hmm. Yep.
But that is not the case. So that's where we are. That's a lot of talk about that. So let's move on. Google is having its Cloud Next event this week, which is where it talks about all the cool stuff happening in the Google Cloud universe, which is pretty big. In the IoT space, Google is decidedly behind Amazon and Microsoft when it comes to hosting different enterprises and building IoT things. However, Google has taken that weakness and turned it into, boom, a strength in a very jujitsu Google move. They announced Anthos, which is Google Cloud's new platform that lets you run an app anywhere. And it is using open standards. It lets you run your apps in Google's cloud, Amazon's cloud, Microsoft's cloud, and it also pulls it down to the edge. And it does that with support for Kubernetes, which is an open source management platform for containers. And I don't really want to get too into the weeds here, but
yeah. but the smart thing, as you said, they took a weakness and turned it into a strength. Basically, Anthos, in a sense, becomes your cloud management platform, regardless of the cloud you use or
where it is. It doesn't even have to be in the cloud. That's the cool part.
Yes, that's correct. It could be hybrid cloud. Yes, absolutely. So you could have, and that's something last year that Google offered with Google. They brought Kubernetes to on-prem or on-site. So you could actually have half of your stuff in the cloud, and you could have your stuff locally, or have redundancy between local and cloud, and so on and so forth. But now they basically put like a cloud management layer on top of everybody's cloud, which is really smart. And what that does, if you're a developer or you're an IT, a business decision maker, you can literally go to one dashboard, one portal, and manage or subscribe to or move from one cloud to another in one place. Your support is there for all of your clouds. Your billing is there for all of your clouds. It doesn't matter if you use Google or not for cloud. And that is really, really smart, in my opinion, of Google.
Yeah. And, last year when I was at Microsoft's Build conference, which actually Build will be in a couple weeks in May, but I thought Microsoft was going to do this. I thought Microsoft was going to create this overarching multi-cloud management system, both at the cloud and at the edge, because of their support for Kubernetes and some of the things they were doing with things called like kubelets, which were Kubernetes for managing containerized software. So maybe we're going to see Microsoft launch something like this in a couple of weeks. And that would be interesting.
Yeah, maybe. It would be interesting. I think Google certainly knows they're behind, and they would love for people to come to Google Cloud for everything. I get it. Microsoft is obviously one of the biggest players here, competing mostly against, I would say, Amazon. Mm-hmm. So I don't know if Microsoft needs to do this, what Google's doing. They might, just to say, we can do that too.
I think the reason the world is going to need this is because in a business setting, you're not just going to have your cloud to manage. Like if you think of like a supply chain management thing, you're going to have other people. You're going to want to see data and run applications that tie back to your business on other people's, infrastructure. Maybe not infrastructure, actually maybe infrastructure.
Yeah, it would be infrastructure because maybe there's a cost savings or something. Sure.
Yeah. So I see this actually being really important, and it could, because again, we're talking about containers, which are easily deployable, like basically applications using only tiny little libraries. So imagine you can just throw an application on one of your suppliers' edge so you can monitor what you need to. Having that management layer becomes really essential. It might make sense not just as Google turning a weakness into a strength, but also because the world we're going to live in demands it. And this actually would be better than like pulling like APIs and that sort of thing, right? It's a little bit more secure. It allows a little bit more customization and control.
A lot of flexibility. Yes.
Yeah. And APIs are hard. People really struggle with like maintaining them, making sure, like communicating with people about like what's going to go down or when you're changing them. I don't know. Anyway. So I think this is a really big deal, and it's a really big shift, and it'll be very important for all these companies who are like, I'm going to use IoT to make my everything better.
Yeah. And just to mention a couple of companies or partners for this platform, Anthos, Google has enlisted some of the usual suspects, but some that surprised me as well. VMware and Dell, they are very often Google partners, as well as partners with the other cloud services, HPE, Intel, and Lenovo. So it's not like they have small, no-name companies that have glommed onto this. So that's what you're going to need if you're going to succeed with this, and that's a good start.
Next up, we're going to be talking about a collaboration between Sonos and IKEA, the furniture store and the smart speaker company, or the connected speaker company, have launched two new speakers. One is a bookshelf speaker that is about $99. It actually looks pretty good. And then the other is a $179 table lamp that is also a smart speaker, and it's ugly.
It's It's typical IKEA design. One color I could live with, but the other color that's going to be available in August, I could not. But it's $179 for the lamp that has the speaker built in, and it's $99 for the connected bookshelf speaker, which definitely looks nice. And I don't know what it sounds like yet because it's not out, but
it probably sounds good.
So it probably does. I mean, if they worked with Sonos, I'm sure there was some kind of specifications and tuning and so on. The strange thing is they're kind of dubbing these as smart speakers, but there's no microphones built in. So I thought originally, like, maybe I could replace one of the, dozens of smart speakers I have in the house, like a Google Home Mini, with this lamp because it's a smart speaker. But there's no microphones built into either one of these.
Yeah, and that's because IKEA was worried about turning off privacy-focused people. And I think when they call it a smart speaker, they're talking about it as a connected speaker.
Right.
Again, we're getting connected. And Sonos, I mean, I've had Sonos speakers since like 2007, and they weren't smart. They were just connected. But basically, they're connected to the internet, so they can play your Spotify, your Pandora, your whatever. So that's what they're talking about there.
I'm not on board with these personally.
I'm about to go into a new house, and it's going to be rented, so I could see picking up a couple. I mean, I love Sonos speakers. They sound great. They work really well. So,
and they've been making a big push to add, like they added Amazon's voice services last year, and this year we're still waiting on it, but one day soon. It was supposed to be last year. They were supposed to add Google Assistant support, but they haven't done that yet. That's in the works. So it's weird to me, like they're making this big push, and yet these Sonos branded IKEA speakers won't have.
This is for the mainstream, and IKEA, they've done kind of their own path with the Trodfee stuff. So it's possible that this is what people want. And we're just crazy.
I guess.
Who knows? Okay, let's talk about inference at the edge, specifically with regards to smart video cameras. There is a conference happening right now. This is ISC West. This is an international security and control systems conference, and you can see sensors, you can see all kinds of cool stuff. But the big trend, apparently, is video cameras with built-in surveillance. They have chips that are capable of running AI at the edge. So running these models to determine who people are, maybe are they people? Are they doing something weird? Maybe even identifying people who are supposed to be there. So this is not brand new, but it is definitely it's going to start being much more difficult to buy a video camera that doesn't have this built in. So Western Digital announced their new storage system for these cameras. So it's got the ability to process a crap ton of data with 4K video cameras, and it also allows for storage and inference at the edge. Qualcomm announced some new chips. So they have the Qualcomm Vision Intelligence 400 and 300 platforms. They're using the latest QCS605 and QCS603 SoCs. That was a lot of data, and nobody really needs to know anything about them except you can basically do advanced computer vision.
Yes, all of that for advanced computer vision. They actually mentioned a ton of partners that are planning to use these chips. It's like well over a dozen. That's kind of surprising.
Yeah, well, it's becoming very much it's just an integral part. People want cameras, they want surveillance cameras, and they want, if you add computer vision at the edge or some sort of modeling capability, you can do two things. One, you reduce the amount of data that you send back to the cloud because you don't have to send everything. Two, you can build a system for alerts. Like there are people in this area when there's not supposed to be people, or these are unrecognized people in this area if you've got a super amazing algorithm running. Because we've long had cameras, right? The challenge, though, is you've got all this camera data and people have to sort through it, and it's time consuming and almost impossible.
And uses a lot of bandwidth, as you said. So if you can keep all that locally and have it processed with a model that is already trained, you don't have to send that data to the cloud. And I would think that might help some people because it's a little scary. And one side, you want surveillance, and the other side, you don't want to be surveilled, right? But if you want surveillance, if you're home or your business, and you don't want the cloud provider to have the information of what the camera sees, this could resolve that problem.
Yeah. And having all that locally processed data means you could dump it, and then it's a little bit more privacy centric. It may not be.
And it's probably a bit faster too in terms of the recognition because
totally.
Yeah.
All right. So a big trend coming out of ISC. Next up, Let's get an update on the mysterious Mistral project from Google. Kevin?
So we talked about Mistral on the last project. A quick recap is that in Google's Chromium public code base, which I read for fun, I found a bunch of code for a new device called Mistral. And tied to that code was Gale, and Gale is the current Google Wi-Fi device. Gale is the code name for that. So I did some speculation and some more digging around in code and said, they're using the new Qualcomm QSC 404 and 405 chips, which have on-device voice recognition. They have a Zigbee chip, Bluetooth and Wi-Fi, of course. They have smart speaker capabilities, digital assistant capabilities, I should say. So my speculation was, this could be the next Google Wi-Fi product as either a 2-in-1 or a 3-in-1 device. So it'd be your mesh networking product plus the Google Assistant, such as in a Google Home, plus potentially an actual 3-radio smart home hub. Well, I still don't know about the last bit because I haven't seen any mention of the Zigbee radio in any code yet. However, this week, as I was spending my fun time reading through code, I noticed that there are now numerous mentions of mesh Wi-Fi capabilities in this device and 4 LED lights, just like what device that you have right now, Stacey? A Google Home?
A Google Home. I was like, 4 LED lights. I don't know what device has 4 LEDs.
I have lots of things that have 4 LED lights.
Yes, I'm like, light bulbs?
It's probably true. You probably do have lots of them. But my specific inference here is, this is definitely at least a 2-in-1 now as your mesh Wi-Fi access point and or as well as a Google Home device. So I'm still waiting to see if there's any Zigbee code added, and I will keep looking because I love to read code.
Yay! All right, other cool news bits. Eve, a company that makes sensors just for Apple's HomeKit program, they have a new energy strip that is available. This is like, I think of them as surge protectors, and you can individually control different outlets. And that is what that is.
Yeah, well, it is. It's a smart power strip that works with HomeKit. So it has 3 regular electrical outlets in it, as well as it looks like possibly a few USBs. Yes. Hard to tell from the pictures. It does have a couple USBs. It is a surge protector as well.
Tracks energy consumption.
Yeah, it has direct Wi-Fi connection, so it should be very easy to set up. So it's not like you're going to have to mess around with any, network settings too much there. And then obviously you could use HomeKit's automations to turn things on or off that are plugged into this switch. And
it'll be $100. $99.95. So,
yep.
Yay. All right. Another news bit. JD Powers, the company that I associate them with JD Power rankings for various things. So like how awesome a company is in terms of consumer sentiment surveys, but they also do benchmarking, and they have signed a deal with a company called Uptake that is based in Chicago. And Uptake basically pulls in tons of data, and they suggest models to make predictions and to take whatever action you think you would need. So the two companies have gotten together to create new benchmarks based on the automotive industry. And this is really interesting. What they're doing is they're pulling in data from connected factories, from connected cars, and they're trying to figure out what kind of metrics might make sense for future vehicles in terms of how long it takes for them to service, how happy people are with them, that sort of thing. So it's really fascinating. And I'm actually going to try to get JD Powers to come on the show to talk about what they're hoping to get out of this in more depth, because they're also going to apply this to the telecommunications industry and the utilities industry. So this is kind of a little teaser. Expect more to come on this, because I'm really interested in how they're going to pull industry-wide data and make that useful for consumers and hopefully for manufacturers.
Yeah, and related to this, it's not a direct relation, but I noticed that on the Amazon developer blog this week, they showed a JD Power survey for consumer purchasing preferences of cars. And it's related because 76% of the respondents said they would want the same brand of voice service they have at home to be on their next vehicle. Sure, that makes total sense. You don't want multiple assistants, one for home and one for your car. But more importantly, 59% said they were more likely to buy a certain car or from a certain car company if the voice service is available in the car. So almost 6 in 10 car buyers want voice services in their car, according to this JD Power survey with Amazon.
Me too. Amazon, send me my Echo Auto, please.
That's right. You ordered that, didn't you?
I did. Well, I applied to buy one.
Oh. We'll see if you're worthy to have one.
Like, come on, man. All right. Okay, I think it's time for our voicemail for the week. It feels like we've covered a lot of stuff today. Let's go now to this week's IoT Podcast Listener Hotline. This hotline is brought to you by Affero. With the 5th largest IoT patent portfolio in the world, Affero provides a proven IoT platform that doesn't risk your brand. Affero customers have experienced as much as an 80% reduction in time to market and 10x higher activation rates. Learn more at affero.io. If you want to call the IoT Podcast Listener Hotline, give us a call at 512-623-7424. You can leave us a message and we may play it on the show. As part of that, you will be entered to win this month's prize, which is a Connect IO system. And what this does is this actually can turn your older alarm system that is wired into a connected alarm system using the SmartThings platform. So if you win this, you're going to want a SmartThings platform. You'll get the connected IO board. This is a tinkerer's dream. This is not for probably normal people. I'm just going to let you know that right up front. But it's a really cool thing. So let's hear from this week's caller.
Hello there, Stacy. You're free to use this on the show. My question is, I have a Google Home and a SmartThings Hub. My issue is whenever I have guests over, they like to turn the Z-Wave thermostat up. I'd just like to know how to stop my guests from turning up the temperature from my Google Assistant. Thank you.
All right. Well, first, I have bad news for you. If these are your friends, you should get new friends because it's kind of a jerk.
Yeah, that's how to stop this. Don't invite these people over anymore.
But let's assume your friends are actually pretty decent human beings. They just have this fun side to them that they enjoy this. There's really one way to help you, but it's going to be it's a way that I don't know if you're going to want to implement. So Google actually lets you do voice matching for the smart home system. All you do is you can turn this on in your settings in the Google Home, and then you will train your Google Assistant to recognize your voice. It's like you repeat phrases 3 times, and then it recognizes you. And then, voila, only when you say something will it happen.
You're the admin of your house, which is great.
You have all the power. The downside is, if anyone else wants to use it, they have to train their voice. So if you live with more than just you're going to want to train their voice. If you have children, you have to then implement this insane, it takes forever, where you have to create an account that's a kid's account. Mm-hmm. It's not fun. It will take you time.
And that's if they're under 13?
That's if they're under 13. Mm-hmm. If they're over 13, they just have to have a Google account and a Google Assistant, and then they train it. But if they're going to train it on your phone...
Pro tip, they're not going to check your child's age.
That's true. But you still have to... They have to have a separate device to train on, to have Google Assistant running on. And then finally, as someone who's actually implemented voice matching on their Google device, it doesn't always work. So sometimes even when I'm asking Google for something, it's like, I'm sorry, I can't help you with that. If you would like to train your voice, go in and do this. And I'm like, Google.
I can't speak to that because I did not turn on voice match because A, I don't have any friends, so nobody comes. And B, if it didn't work for my family, they would be very upset.
Yeah, my family, basically in my house is, hey, G, turn on television. And then G says, you don't have permission to do this. And then you hear, hey, Madam A, turn on television. And then bloop, the television is on. So yeah, that's usually how that operation runs in our house.
And that explains why you have both voice assistants.
There you go. And this is an underlying problem that is not being addressed yet in the smart home, which is basically admin rights for individual devices. So not everybody in your house should be able to turn the heating and cooling on. Maybe not everyone in your house should have access to the water.
Everything.
Yeah. Maybe not everyone in your house should have the ability to invite people to open your door locks. That's actually, most door locks do actually have those settings. So you can let people in as an admin or as a guest or those kind of things. But
it seems like there should be another layer of security in here at some point in the future to say, yes, I am the admin of the house and only the admin can change the thermostat, or only the admin and these people. So it gets a little more granular as opposed to voice match, which is an all or none situation, number one. And number two, we have other devices that can help determine who's actually in the room, for example. I presume that this person's guests are doing it when he's not in the room, and if you have a camera in the room, maybe the voice assistant can say, wait, anybody can turn, no, you're not here. That doesn't make sense.
You just crossed the line to creepy with that camera. I was going to say, what we actually need is both. You need the ability to know, you recognize who is asking for something, and then you need a layer of basically like Active Directory for your home. Oh my gosh.
Yeah. I can't believe you went there.
I did. But
AD for the smart home. AD for IoT, the newest Azure service. No, thank you.
Okay. Well, on that grim and devastatingly awful idea, please don't do that. I don't want to spend more time managing things. We need to make it easier, not harder. Let's call that the end of this week's news section. Stay tuned for a message from our sponsor and for our guest, Andy Corvus, who is really awesome and is going to talk about how we need to think about biomarkers for medical devices and how we're authenticating and actually doing some reviewing of claims about certain digital medicine. And she's also going to talk about how the FDA is really becoming a model for other regulatory agencies who want to address digital transformation. So all of this and more after a message from our sponsor. This week's sponsor is Software AG. Hey everyone, we are taking a break from the Internet of Things podcast for a message from our sponsor. This week's sponsor is Software AG, and I have John McTavish, who is in the IoT group at Software AG, here with us. So this week we're going to talk about how to succeed in the IoT. But before we do that, can you remind us what it is that Software AG does in the IoT?
We really provide great solutions involving digital transformation. We simplify and connect software, applications, devices, which can be your IoT devices, and people to really quickly infuse business value across your organization. Really get that data to where it needs to go quickly and securely to make really great business decisions that can affect your bottom line. So we have a great solution called Cumulocity. It's an IoT enablement platform. And we also have 3 different analytics solutions that can layer on top of Cumulocity.
Well, John, we're here to talk about how we can succeed in the Internet of Things. What are the first things we should think about when we're taking this on?
A couple things. One, is your IoT project really mapped to a key business initiative that's really been driven down by a VP or C-level? Why I say that is because to make it successful, you really have to have buy-in that IoT can solve a critical business need. And that's really the basis to get an IoT project going. Stacey, what makes a successful IoT project go is understanding your ecosystem. I see 3 critical parts. There's the hardware part, the software part, and the application analytics part. First of all, I'd like to talk about the hardware part. It's imperative that the companies understand that procuring hardware, installing hardware is a critical part, and not every company has strength in this space. That is one part of the ecosystem you have to understand, either to do that internally or outsource it. And the second part, Stacey, is really getting the data flowing, and that's where Cumulocity has its strength. Once the data is presented outside the sensors and hardware, Cumulocity can securely manage that data to the application layer. And the third part of the ecosystem really is the application analytics part of the solution. Cumulocity has a great application that allows for quickly designed applications to get data to the business people that need to make decisions. We also have 3 different analytics solutions that can be implemented within Cumulocity that adds a greater layer of value past the applications, where you can make really, really great decisions that can affect change within your organization.
Okay, and what are some of the common pitfalls when trying to implement some sort of IoT strategy?
Moving too fast, too quickly is one of the things I see. These projects can take a long time to implement, and trying to bite off more than you can chew is one of the pitfalls I see. What does that really mean? It means really to try to connect thousands of devices at once, implement multiple products at once. Let's just pick one product, prove the value that ties to a business case, and then move on through a prescribed period of time.
And John, where can I go to find out more about Software AG and the Cumulocity platform?
Please go to softwareag.com/IoT now to enable your 30-day free trial. During the free trial, you'll have access to our IoT team to help enable success during the trial.
everyone, welcome back to the Internet of Things podcast. This is your host, Stacey Higginbotham, and today's guest is Andy Corvus, who is the CEO and co-founder of Electra Labs. Hi, Andy. How are you?
Hi, great. Thanks for having me.
Man, I am super excited because we are going to talk about IoT in healthcare. Wah, 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 wah. That's my happy noise. All right, so let's kick it off with telling everybody what it is that you are trying to do with Electra.
Yeah, so we are working with connected devices that can remote monitor people in their own homes. Where we really started was over time, we've realized that people are increasingly more honest with their phones than they are with their doctors. If you ask anyone, including myself, if you said, well, how many times did you work out last week? I would probably give you a number that's far higher than what my Fitbit says. I mean, if you think about a lot of people, like we hate filling out surveys to get any sort of remote data. And so a lot of these technologies finally have gotten to a point where they're collecting clinical grade data. They can do them passively in your own home, and they don't look terrible. So more and more people are wearing connected products. And so what we're doing with Electra is helping mostly today pharma companies and over time, doctors and payers and providers use these sorts of connected tools remotely and have better relationships with their patients.
Okay, that is both awesome and exciting and really promising and also scary as all get out. So we're going to dig into all of that. But first, just the idea of being able to do this is confusing to me in some ways because I feel like I have a lot of these connected devices, and that might range from my Fitbit to, I used to have this crazy like anti-snoring device that like it tracked my snoring and then made all sorts of correlations about my health. But all of these things, they're not really FDA approved necessarily or peer reviewed. So I kind of call them digital snake oil. So I'm really curious how you guys are thinking about making sure these devices are actually drawing the right conclusions about your health from the data they're gathering.
So one of the things that often people are excited about in healthcare is the idea around digital health. What's happened with a lot of digital health is really thinking about what's not digital health. So anything that has software in healthcare, from medical records to some of the connected devices to apps, seem to be in this realm of digital health, which sometimes feels a little bit more snake oily than having actual clinical evidence behind it. So there's been a movement because people both realize that these sorts of tools have a pretty meaningful way to really change how we deliver care, and a new need to think about how do we actually build a regulatory strategy and a set of trust around quality metrics. And so there's been a movement towards what's called digital medicine, where digital medicine is a subset of digital health that has that level of clinical evidence to it. And many people split it into about 3 different categories. So software and algorithms that take a measurement, software and algorithms that do some sort of diagnosis, and if software can measure and diagnose, can it treat? And there's a whole realm of new products called digital therapeutics that have that sort of treating capability.
Okay, that is a lot. And what is the goal of your company in this wide world? You've talked about biomarkers and acting as this kind of pharmacy for digital health products. What does that actually look like?
Yeah, so we focus on the measurement side. So this idea around digital biomarkers and using software and algorithms that can measure some sort of behavioral or physiological outcome. So that could be something like step count, which takes your height, weight, age, gyroscope, accelerometer, and then predicts whether or not you make a step. So all of these sorts of digital biomarkers are forms of types of algorithms that then can be used to either inform or drive different parts of care. So specifically, we work with pharma companies that are doing something called decentralized clinical trials, which means they're collecting data outside of the clinic, and they're collecting things like vital signs or tremors or any sort of product that is collecting some sort of digital biomarker data from the participants in the trial.
And are you certifying the algorithms or?
We have an atlas that has 640 different types of products. And so generally, a pharma company needs to think about which type of product they would want to use across 4 spectrums. So one is around verification and validation. Verification being, if I walk 100 steps, does it measure 100 steps? And validation is, does 100 steps mean something for my PTSD or for my Parkinson's or what my clinical population is? Second is around usability. So like, what's the battery life? Can I wear that in a shower? Does it look like a prison bracelet when I wear it? Third is around the security principles for this. So like, how do I actually manage the risk? So if I'm instrumenting someone with multiple sensors, like how do I think about the attack surface now of the person? That's something pharma hasn't really thought about before. And then fourth is around the data rights and management. So even if the tool is accurate, even if it's relatively usable, even if it's relatively secure, this doesn't solve the Cambridge Analytica issue where data were shared in not a hack, but were shared in a way that people did not anticipate their data being shared. And so what we do is we have a set of objective measures across each of these 4 concepts, and then we score them effectively like a nutrition label, where you might say, okay, really need to make sure this has a peer-reviewed paper or it's been used in an FDA level study, and that can cover how you think about accuracy. I don't really care if it can be used in the shower or not. That's not something that's important to us. And then you can make trade-offs to decide which type of tool is, quote, fit for purpose for a given environment.
I had never thought about that. Side effects might include dry mouth and hacking. Oh my gosh. Okay.
Yep.
So this would be something like my Fitbit or my Apple Watch, and I bring that in, and it would be that for a specific type of use case, because my Fitbit might be awesome for steps. The Apple Watch might be great for measuring certain types of heart issues. Is that the way to think about it?
Yeah, and what's really been interesting is I think people historically have said, okay, we have consumer devices and then we have clinical devices, and these things are totally different. But what's starting to happen is that they're merging. So many of the clinical device companies have been partnering with tech companies that have created more nimble and small products. So depending on what they need, you might go for either. And so for many of the more traditionally consumer products, they've been working with the FDA. So the FDA has a new program called the pre-certification program, and a number of big tech companies have been involved in it. So Samsung, Verily, which is an offshoot from Google, Apple, Fitbit, and a number of others are all working with the FDA to create higher evidence-based products that they can then submit and have part of the regulatory and health paradigm.
Okay, and we will get to the FDA soon. But before we do, let's talk about the big elephant in the room, which is privacy. And actually, I guess it's not the elephant because you totally named it when you were talking about this earlier. So you mentioned that right now, this is mostly for pharmaceutical companies that are using this, and it is for their clinical trials. So let's talk first about, hey, what does this mean and how would you use this in a clinical trial? And then we'll talk about what this means as it expands to a broader population and how we're going to think about privacy and security. Let's think IoT and clinical trials. What does that look like today?
Yes. So I think privacy kind of has 2 ways that I generally think about it. So privacy being more like one aspect is a security part where maybe somebody's attacking the system. And then there's also privacy where you don't necessarily have an attack, but the way that the data rights are structured, somebody can do third-party transfer. So like say more in an attack security concept. Pharma has never really had to think about anything like that before. The data that they've collected in clinical trials are things like blood draws or other things that are relatively standard, and they have most of their data stored in ways that they have to for compliance. And they've never really had to use things that are internet connected on multiple times a day that are remote from the center. And so this kind of creates an entirely new type of infrastructure that they now have to think about and manage.
Are they looking at using this data in a clinical trial setting? I assume that this data is isolated for that setting, or are they trying to create massive stores of potential patient data? What are the rules in place that they're thinking of when trying to use connected devices?
I think many of this is up for play. For most pharma companies, when they think about running a clinical trial, their data has always been their data. So they run a study and all the data belongs to the sponsor of the study. What's different about a lot of connected tools is they don't necessarily have back-end systems that are just going to store clinical trial data in one section. They pool a lot of it together. And in fact, many of the wearable companies use that data to retrain their models over time, and they don't have a way of splitting it out. So this is pretty new for them to think about, okay, if you're going to collect data on a relatively vulnerable patient population, how do I ensure that these data maintain private, or that we know how something has been consented over time, that we can manage it in a way that's responsible for our participants.
Okay, and let's go big picture on this, because you mentioned earlier that the concept of personalized medicine is basically surveillance, because to deliver this care, you're going to have to understand someone inside and out in a way that's really kind of, I'm going to say frightening. That's a big responsibility. How should we think about that world? Is that something we should really welcome? Are the benefits outweighing the costs?
I think the constant question is just making sure the benefits outweigh the costs. In some instances they will, and some they won't. For me, the thing that starts to get more important is really thinking about some of the norms that we have. So questions that people always say is like, well, isn't this data de-identified? And at some point, you collect so much data that de-identification becomes impossible. So an analogy is thinking about, how would you de-identify my genome? you can't, right? Like my genome is unique to me. And if it were truly de-identified, then it wouldn't really be my genome anymore. You might be able to strip out parts of personally identifiable information when you store it. But if I ever had a snippet, you'd be able to compare it back. Same with biometric data. 30 seconds of walk data, and I'm a uniquely identifiable person. So instead of really thinking about things like, oh, who owns the data? There's not really data ownership. It's really much more about data governance and who gets access to it. And really thinking about, okay, if we're going to be in a system where things can't be de-identified, how do we make sure that only the right people have access to it and they're using it in a way that's responsible?
And how far away are we from that?
It really all depends on how the registries or how the data are stored are maintained. And then the thing that I really like about working with pharma is that they think a lot about human subjects research. That's the whole work that they do. And so there's a lot of norms and thoughts around informed consent and making sure that that consent is truly informed. If you think about post-market and tech companies, we're constantly in human subjects testing. I'm sure Facebook's running a number of experiments with me about what they're showing me on the news feed and how I respond, but that's pretty much unconsented human subjects research. And so the thing that I'm more nervous about is not necessarily what happens in pharma, because I think we have a lot of good structures, but as this starts to move out and more of this tech is used in a non-regulated space, how do you make sure that somebody's actually consented and knows how their information is being used over time?
Yikes. All right, which seems like a good segue into the FDA. You were recently an entrepreneur in residence at the FDA, and what were you doing with them?
Yeah, so I was an entrepreneur in residence at the FDA. It was called a special government employee. I have now wrapped that up. I'm no longer an FDA employee. What I was doing with them is the FDA has been very forward thinking about how to handle some of these tools. I think there's so much opportunity, and they recognize that holding things back is in many ways a different way of stopping someone from getting care. So we definitely don't want to have things that hurt or harm people, but also having a solution that you don't allow people to get access to causes a different type of harm. The FDA has realized we need to rethink how we manage software products. So today, you're not making constant changes to drugs over time, but we are making constant changes to software. And if you had to imagine that Facebook could only ship one software update a year, that would be crazy. And we don't expect Facebook to maintain or sustain somebody's life. And so we need to rethink as a society and as a regulatory institution, how do we, as a whole group of people working in software, want to maintain this sort of regulatory update?
Okay, and that is key. So how do we adapt the approval process for medical devices is one aspect that I know the FDA's worked on. Another is actually a big topic that we've had people on the show talk about, which is how do you create a security framework that these devices can be both tested and make sure that they're not vulnerable to hacks, and then also updated on a regular basis. And this can be part of that, regulatory approval process that we just talked about, but it could also be possibly making sure that things actually get updated, which doesn't always happen, especially in hospital settings.
Yeah. I'll answer the first one because one of the pilot programs I think is quite interesting. And then the second one. One of the pilot programs the FDA is working on is something called pre-cert. And the idea behind pre-cert is that you would pre-certify a company under a series of excellence principles. So those include cybersecurity responsibility, quality, safety. And companies that have this level of excellence then are able to ship updates in a way that they can do that a lot faster and have a different type of faster review. This is amazing and totally different from how the FDA has ever regulated a product before. We don't say, hey, Pfizer, you make good drugs, kind of ship as many drugs as you want under this paradigm. But the changes for software really make a lot more sense. So that is something that is currently being tested. On the security side, there's a lot of different ways that the FDA is thinking about this. They've released a pre-market and a post-market guidance in the last year to 2 years. One of the big topics that has come out of that is thinking about something called a cybersecurity or a software bill of materials. And the idea behind a software bill of materials is thinking about a piece of software like a nutrition label. So today, nobody builds software from scratch. We all put in third-party components into that. And if you have a third-party component that has a vulnerability, how do you make sure that, one, you know that that component is in your piece of software and that you've been able to do the update? And the idea around having a list of ingredients for security bill of materials, then you would be able to maintain and manage that update process over time.
And what else is the FDA working on? Are those the two big issues that the FDA cares about when it comes to connected medical devices?
So I definitely check out the two guidances that they have. One of the things that I think has been really interesting about the way the FDA is taking this approach is making sure that they're not just building something in-house and then releasing it out, but how do they do the best type of collaboration? So DEF CON, the security conference, has been a surprisingly, perhaps for many people, place where the FDA has found out a lot of new information and has really been expanding its thinking around how to deal with security vulnerabilities and working with security researchers. So about 3 years ago, the FDA went to DEF CON for the first time, which is amazing because, as you can imagine, DEF CON is not a place that feds generally go publicly. I think many CIA, NSA, they all kind of go undercover, but they don't show up as a fed. There's a game called Find the Fed, and you do not want to be found. The Biohacking Village, which is one of the villages under the main DEF CON, which looks at a lot of connected devices and different sorts of biohacking products, welcomed the FDA in and has been working collaboratively with them. So one of the things that has been kind of neat is in January, the FDA had a very large public workshop around cybersecurity, and they launched a new initiative called #WeHeartHackers. And if you go to wehearthackers.org, this is an initiative where the FDA has been working to build more collaboration around medical device communities and the security research community. So Abbott, Thermo Fisher, Philips, BD, and a number of other companies have all committed to attend DEF CON this year and work collaboratively with researchers and regulators.
And this has actually been a model that I personally think should be applied to other industries. For example, we actually talked about this, Kevin and I, earlier on another show with regards to the Boeing 737 MAX and the sensor malfunction. And the idea here is if the FAA actually had a process that mirrored some of the things that the FDA is doing, we may not have had that issue. And also, just going forward, as we're talking about like autonomous cars and giving computers more control over more things, this sort of framework makes a lot of sense.
I know, I think that's important. And the thing that has been really interesting and amazing for me is before the FDA got involved, these two communities had trouble working together. So the security research community started researching a couple different devices. One of the first ones that they were looking at were pacemakers. Pacemakers generally try to maintain as long a battery life as they can and not do anything that's computationally expensive. Turns out encryption of many types is computationally expensive. And so a lot of them weren't encrypting. So there were relatively trivial exploits that you could do that could reverse engineer protocol, drain the battery, and or initiate a shock from the pacemaker. So for many of the researchers, when they found this, they said, hey, we should disclose and help them do an update. And when they were doing the disclosures, unlike any normal tech company, when you do a disclosure, there's something like a responsible and coordinated disclosure that you can then have the update, maybe have a bug bounty, and everything is fine. With the connected devices, the device companies are like, hey, thanks for doing this. We're going to sue you. And the researchers are like, wait, what? Why are you doing this? And they're like, well, you tampered with our device. We just can't ship updates whenever we want. We're regulated. And so we have to sue you now. And so the FDA stepped in and said, hey, we are not going to be the problem here. Also, that is a fallacy. If you do have a security incident, you can submit an update. And so we want to make sure that this sort of feedback mechanism is happening better. And so that has been a really big part of some of the FDA's work too, is helping some of these bigger companies who are learning how to do things like coordinated disclosure can do it in a way that they can solicit more of these sorts of updates from the community.
And that is a really important thing to say. So everybody out there listening, if you have a medical device and you need to update it for security reasons, the FDA is totally okay with that. Okay, well, Andy, I have learned a lot. I am cautiously optimistic about the future of personalized medicine. I love that you're helping address the digital snake oil problem, and I appreciate what you've done actually with the FDA as a person who uses medical devices. So
one thing I try to balance between is like not being too fudge, like because it does scare the crap out of me for a lot of this stuff, and also how to use these tools responsibly and safely. I think in a lot of tech, there's the whole move fast and break things, and that means people die, right, in healthcare. But the nice thing about healthcare being a bit slower is we might have a chance to design systems that better serve people. And so I think this is a really powerful time, both for regulators, for companies that are trying to develop trustworthy systems. More and more people are competing on trust. So how can we make sure that we put responsible and really helpful tools to solve some of the biggest issues that we have in healthcare?
So thanks for coming on the show.
Thank you for having me.
That's it for this week. Thanks so much for listening. And remember, if you'd like more IoT news, sign up for my newsletter at stacyoniot.com. We'll see you next week.